Officially launched on the 9th of March 2022, the Digital Health Payment Initiative and Research in Africa project is a 3-year investment funded by the Bill and Melinda Gates Foundation, implemented in Anglophone and Francophone regions, coordinated by Makerere University School of Public Health in partnership with University of Dakar in Senegal. The project, whose main goal is to identify how and under what circumstances digital health work payments can support effective campaign delivery, is marked with the intention of enhancing capacity and producing contextually appropriate data regarding the influence of health workers' digital payments on the effectiveness of immunization campaigns in sub-Saharan Africa.
The project has been running for about 2 years, and we work through subcontracting. We have multiple partners in multiple countries, both in the African-speaking, English-speaking countries, but also in the French-speaking countries. We are in Senegal, we are in the DRC, Burundi, Ivory Coast, but also when you come here, we're also in countries like Kenya, Malawi, Nigeria, and more. So multiple countries, both in English-speaking countries, but also French-speaking countries. Now, our work, we are not the one who do digital payment. Digital payment is usually done by the government, but we observe what they do. We study what they do, and the aim of the project is to see what is the value of digital payment and what is its promise. Does it improve the way health workers are paid? Does it improve the experience of working or payment? Do they get the money on time, in full? And does this motivate them? And in return, does this also strengthen the programs that they implement? For instance, if they are doing a polio campaign, want to see if the campaign is successful or not. So those are some of the issues. We've commissioned about 17 studies, and for most of these, we have very good reports from all these studies, which we've started publishing into papers. They are individual papers. We have a group of students we funded, but also we have other researchers that we funded. And also we are planning to actually publish a supplement. A supplement is a group of papers that speak about one subject. And this will be coming sometime later this year in the BMJ. But also we have policy briefs, we have regular webinars, we have a community of practice where people can join and discuss the value of digital payment. From what we are saying, we say that there is no alternative to digital payment. Digitalization is the way to go. We just need to improve it. So in terms of promise, I think the promise is huge. It is found, it's acceptable to health workers, it's acceptable to policymakers, but also it saves money. And it reduces corruption. And for women, we've had stories of women saying that they are happy because they don't have to leave home to go and find money. They also get their money on their phone, which is password protected. So husbands, as if women, and should not share their money with husbands, but husbands cannot just access it or anybody without their permission. So sort of it is empowering to women, to give them autonomy and to make sure they have their money. And when the money is available, they receive it. Of course, the money is too small, but which health workers get paid during most of these campaigns, but at least they receive it directly. Take, for example, a community health worker in a very rural area, like in my village in the Moka. A community health worker whom we call various team member. And they do a campaign to mobilize. They want to get their money in time. They also want to get it in full, and they want to be in control of the money. But this is what digital payment is paying. Is getting health workers to experience they are getting their money. As opposed to before, where all these people moving. Can you imagine if you are doing a campaign in the whole of Uganda or DRC, and you move with cash? There'll be too much money, but the security of the money is a problem. and the risk that people will take part of the money and somebody may not be paid in full. So here, all this can be tracked. There's also something very important because the ministry is able to get full accountability of the money and in a very short time. So there are so many attributes of a very good program where we see accountability, we see issues of access, issues of equity, gender issues, all of these being met within digital payment plus effective programs.
And here is what one of our requests for application grant awardees from Malawi has to say about the project and digital health payments at large.
My name is Ndira. My background is public health, digital health, and entrepreneurship. I'm the founder and CEO of Compelling Works, a development consultancy firm that promotes health, well-being, and development through practical digital solutions. We have branches in Uganda, Malawi, also in China. Both Uganda and Malawi has worked with the School of Public Health, Makerere, as well as another university in Malawi, Kamuzu University of Health Sciences, to try and understand the effectiveness of digital health payments, replacing the analog, because up to now people have been paying cash, which come along with several issues. For example, people being waylaid, frontline community health workers being waylaid in the evenings when they are returning home because someone knows they have just received cash. So ultimately, one could say that digital payments it's a game changer. It's definitely a game changer, but there's still a lot that needs to be unpacked. Our experience has been very exciting. It has unpacked a lot of things at operational level, some of the things that need to be streamlined in terms of operational policies and procedures to make digital payments more efficient. But it has also helped us get some insights into how we treat, for example, urban, peri-urban, and rural areas when it comes to digital health payments. But in general, we think it's a good move. And we are grateful that international organizations like Gavi, like World Health Organization are embracing this with backing from donor organizations that are interested in finding out whether it's working right. One of the research looked at like the institutions that are supporting digital payments, the structures, the government, the telcos, structural barriers and all that. That was the first study. The second study looked at the extent to which digital payments are contributing to or improving financial behavior. When we talk of financial behavior, we are looking at different cultures, the culture of spending, the culture of saving, and the culture of investment. But we are also looking at agents, like, for example, how much autonomy do I have over my money if it is sent to me digitally or if it's sent to me cash. And when you look at that, many dimensions come into play. For example, gender dimensions. Are we supporting, for example, women to have more agency over funds that are transmitted to them digitally over analog? And so the research activities that we conducted unpack most of these things. For example, we all know that you just have to click the button and the funds will be transmitted. But we did not know that in rural settings, you're going to have most of the frontline health workers have difficulties, for example, in the first place, finding an agent to cash out for your money. In the second place, finding that that agent is liquid enough to cash out your money. All these issues, or sometimes the agent is there, they're telling you they're liquid, but the network is down, so they cannot transact. We've also had situations where, for example, the process of managing the beneficiaries, the person supposed to receive funds, leaves a lot of room for improvement. Like, names are captured in an Excel sheet and sent to the telcos to disperse payments, and somewhere along the way, phone numbers change. So how do you handle such updates? Or how do you handle situations where a community health worker is using a next of kin to receive money? What procedures are in place or systems are in place to authenticate such? So ultimately, much as there is a lot of positive feedback about the fact that you can easily access your money, you can also easily spend it, and you feel you have better control of it, I think there is a lot that can still be done to strengthen policy and strengthen procedures. There's a lot that needs to be done to strengthen the last mile systems. I talked of, for example, putting names in an Excel sheet. Recently, when I came back to Uganda, I learned that, for example, Stanbic has now introduced FlexiPay, which is a much more organized system, or APSA has teamed up with Bionic to improve on that last mile. In some countries, for example, in the case of Malawi, there's still work that can be done in that context. But then, from what we have heard from community health workers, to know that you can sit in your office and receive funds sent to you digitally, compared to traveling several kilometers. And remember, in rural settings, transport is not really readily accessible. So some people actually go on foot. And then when they reach there, they find the agent is not liquid or network is down. All those challenges, or where they have to receive cash, and people know they have cash, so when they're traveling back, all those risks. In general, there's a very great appreciation for digital payments as a substitute to analog payments. Health workers have told us they've received their funds in time. They were able to go to the field in time. They weren't preoccupied by the fact that they're waiting for money or trying to access funds in order to do their work. Especially the community health workers in urban and peri-urban settings. Most of them predominantly were very positive about the fact that digital health payments funds they receive digitally has helped them get more organized. And I think that frees up a lot of space and helps the health worker focus on the core mission of saving lives, as opposed to trying to attend to administrative logistical issues that tend to be bureaucratic. Our study just focused on community health workers with a specific focus on frontline health workers.
Yes.
We've not looked at the health facility and the benefits at that level. But I'm also thinking, even in the health sector, we have looked at some countries that have really made very strong advancements in not just digital health, but digital government, or what you call e-government. Countries like Estonia, when you look at the history of their platforms, like the X-Roads platform, we know it started with the banking sector. Recently, I was in Nairobi in Kenya. I quickly cashed out money from an ATM and went to have lunch in a restaurant, and I was told that I can't pay with cash. I had to have an M-Pesa account. And now we all know that mobile money payments actually started in Kenya. It's M-Pesa that kickstarted this whole thing.
Yeah.
And it's exciting to see that a country like Kenya is cashless, And when you talk to the local people, they'll tell you the changes. Security has really improved. There is very, very little, street crime, because people are not moving with money. And even if you stole their phone, you need a fingerprint. So I think the health sector can borrow a lot from the private sector, and that's already happening. And I think the initiatives that have started should be supported to continue. There's a lot of potential in digital health payments, but research will ultimately act as the bedrock for informing whatever interventions or whatever actions we take to improve on digital health payment initiatives. The future is now. Yes, there is no future about digital payments. It's now.
Okay.
We are in the information revolution. If it's working in Kenya, it can definitely work in Uganda. And there's a lot already going on. I think Momo is doing MTN Momo is doing a great job. There are so many innovators coming up with solutions. So I think what we need to do is to build the momentum, get ourselves organized, and keep pushing. There's a lot going on that front already, and it's just about how do we rally behind it in order to make it happen.
The project has funded studies from scholars and practitioners affiliated internally with the host universities and issued competitive requests for applications to external researchers.
This thing of a one solution to everything doesn't exist in the complex systems. I think one is government adoption of policy and support. Two, it is this having the right infrastructure that is reaching everyone. But number three is that access to mobile phones, especially to the poorest, to people in the most remote areas, is critical. And finally, it is a source of money. I mean, if people, unfortunately, we still have digital payment where people have to get money digitally, but they're withdrawing it. So they have to withdraw money from somewhere in order to expend it. But innovations are certainly needed, whereby when you are paid digitally, you don't have to withdraw the money. I think it is working in the West. It should be able to work here. So this is a space for innovation.
A community of practice was also cultivated. Policymakers and practitioners engaged to stimulate new research opportunities where there were pending health campaigns, existing health worker databases, and ongoing innovations in digital payments.